So good evening all. Today our topic of discussion is the pulse. First of all, what do you mean by pulse? So the pulse meant for expansion and elongation of the arterial walls passively produced with the pressure changes during systole and diastole of the ventricles. Or it is a transmitted pressure from the heart to the periphery during the systole and diastole of the ventricles. Next, what are the important points on the pulse? So the important points of the pulse are the variants of the pulse are the very important. So what are the commonest variants? So first of all, the most important one is the pulse parvus or tardy pulse or pulse parvus et tardus. So this is nothing but a slow and low amplitude of the pulse. So there is a low volume and a gradual raising of the pulse. So this is commonly seen in the aortic stenosis. So when the aortic stenosis is there, so automatically it will causes outflow obstruction from the ventricles into the aorta. So that's why there is low amplitude and a gradual raising of the pulse will be seen. So that's why it is called as a pulse parvus. And the second one, biciferous pulse. So when there is two systolic peaks are there, it is called as a biciferous. And two, so two systolic peaks are there, and or there are two peaks are there in the systole. So it is called as a it is called pulse biciferous. So this is commonly seen in, so when the combination of both aortic stenosis and aortic regurgitation is there, so when the AS and the AR is there, so biciferous pulse will be seen. And the second one is dicrotic pulse. Dicrotic pulse is nothing but dicrotic. So it's one peak at systole and one peak at diastole. So that's why it is called as a dicrotic pulse. So this is commonly seen in low volume pulse or low amplitude pulse. So when the volume is low, so dicrotic pulse will be commonly seen. So that's why this is commonly seen in the LVF. Next, and third and fourth one is the pulse alternance. So pulse alternance is nothing but, so the rate of the pulse is regular, but its amplitude is altered. And some of the pulse are high amplitude and some of the pulse are low amplitude, but rate was regular. So that's why it is called a pulse alternate. So this is commonly seen in the LVF or dilated cardiomyopathies. And next one, pulse paradoxicus. Pulse paradoxicus means, so usually, so in the inspiration, so there is increasing in the pulse rate will be seen, but pulse volume is low. So during inspiration, so the volume of the pulse or the pressure of the pulse was decreased for 10 mmHg. So if it is more than 10 mmHg, which means, so when there is drop of the pressure of the pulse is more than 10 mmHg during inspiration, so it is called as a pulse paradoxicus. So pulse paradoxicus is nothing but, so exaggeration of the normal process. So during inspiration, 10 mmHg fall of the pulse will be seen. If it is more than 10 mmHg, so that's why it is called as a pulse paradoxicus. Next, next one is rapid rise and rapid fall of the pulse, or hyperdynamic pulse, or Corrigan's pulse, or Toy's pulse. So when there is high systolic and low diastolic, so there is systolic peak is high and the diastolic peak is very low. So which means, so the difference between the systole and diastole will be more. So that's why it is called as a wide pulse or wide pulse pressure. So Toy's pulse or Corrigan's pulse, hyperdynamic pulse or wide pulse, so all are same. So which means, so when the systolic volume is high, when the peripheral resistance is low. So when the systolic volume is high, it causes the increased systolic pressure. So when the peripheral resistance is low, so it causes the low diastolic pressure. Okay. So this is commonly seen in the anemia and beriberi and thyrotoxicosis and Pez's disease, okay, as well as the after exercise, as well as complete heart block or any bloody cardiac conditions. Next, opposite to pulse paradoxicus is commonly seen in the HOCM, obstructive cardiomyopathy. Okay. Next, pulse deficient. So the origin of the pulse is there at aortic wall, but it is not conducted to the peripheral arterial. So that's why it is called as a pulse deficient. And so the origin of the pulse is there at aorta, but it is not conducted up to the peripheral artery. So that's what is called as a pulse deficient. So this is commonly seen in atrial fibrillation as well as the thickened arteriosclerotic conditions. Next, the most important is the sinus arrhythmia. So sinus arrhythmia, it is a normal mechanism. So increasing in the pulse rate, so during inspiration, and decreasing the pulse rate during expiration is called as a sinus arrhythmia. So these are the important points. Yes, what are the first one is pulse paribus, aortic stenosis. Second one is a bicephalous pulse, both systole, both aortic stenosis as well as aortic regurgitation. Next one is a hyperdynamic pulse, or Colligan's pulse, or dancing pulse, or pregnancy pulse, or wild pulse. All are or twice pulse, all are same, or hyperdynamic circulation, anemia, AV fistula, and beriberi, wet beriberi, and thyrotoxicosis, as well as Paget's disease. Okay, next one is diachrotic pulse. Diachrotic pulse means as one pulse is systole peak is two systole peak is there. So one is at systole, so one is at diastole. So next one is a pulse paradoxicus. So decreasing the volume of the pulse for more than 10 mm during inspiration is called as a pulse paradoxicus. So this is commonly seen in the conditions where there is increased intrathoracic pressure is seen. So this is commonly seen in the tension pneumothorax and COPD and bronchial asthma as well cardiac tamponade. So whatever the condition that increases the increased intrathoracic pressure, so that may trigger the pulse paradoxicus. So next one is the pulse deficient. So this is commonly seen in atrial fibrillation and thickened arteriosclerosis. So these are the important points.